Hello and welcome to Senior Living. I am Lynn Brennan, your host, and we are going to talk today about spinal health. We welcome our very special guest today and our expert to the program, Dr. Joni Smith. She's owner of Active Life Chiropractic for 20 years with 3 locations in Lincoln, Nebraska. Welcome, Dr. Smith.
Thank you.
So, in the year 1860, life expectancy in the U.S. was about 40 years. And then in 1960, life expectancy was 60 years. And now today, just as we've advanced technology in all other ways, so have we advanced in our age, and we are pushing age 80 as life expectancy today. And of course, a lot of people are active and healthy at age 90 and 100, which is 100, the fastest growing segment of our population, the centenarians. These are astounding facts, and therefore today's program. As we age, there's an increased need for special attention to our health to maintain that vim, vigor, and vitality that we're all accustomed to and enjoy. But most people don't realize, however, that overall health comes to rest in one particular area of the body, the spine. So, Dr. Smith, the backbone, what is it and why is it so important?
Well, the backbone or the spine is essential to your overall health because it encases the nervous system. So as we all know, our brain is connected to the rest of the body through the spinal cord. And the spinal cord runs through the spine, and the spine protects the spinal cord.
Wow. You said a mouthful right there. So everything about us, our whole body, is related to the spine.
Yes, between each and every joint in the spine comes out a nerve, and those nerves are going to all the organs and tissues throughout the entire body. And so the health of the spine is crucial not only to whether you can move well or not be in pain, but also so that your organs are functioning correctly.
Very interesting. And then, as I'm going to say, how does the spine relate to health, as you were just explaining?
Yes, between each and every joint in that spine comes out that nerve. And so it's amazing that we want to make sure that we're keeping that spine healthy. And how we keep your spine healthy is making sure that you have proper movement and mobility in through those areas of the spine so it doesn't cause any interference from the communication from the brain to the rest of the body by putting any pulling or pressure on those nerves.
Okay. What is the spine made up of?
Well, as you can see, the spine here basically is made up of the neck, which is 7 cervical vertebrae, and then we get into the middle back portion of the spine, which is your thoracic spine, which there are 12 bones. And then as we go down into the lower back, we have our lumbar spine, which there are 5 bones, and then we have that sacrum or tailbone area at the bottom.
All right, so we all have all of this minus the colors.
Minus the colors.
That's beautiful, amazing. I'm so glad you brought this today. This is going to be very helpful for us. So this is the normal curvature of the spine, is that correct?
That is correct. And so as you can see in the lower back, your spine's going to curve towards your body, and through that thoracic spine, your spine is going to curve out, and then again in that neck area it's going to curve forward. And those spinal curves are designed to balance your body weight so that you can stand up straight, but also so it evens out the pressure or the weight throughout your body.
So while you're holding that, could you tell us about what is subluxation and how does that happen?
Absolutely. So chiropractors use the word subluxation when those spinal joints stop moving back and forth correctly or become misaligned. So that's what we treat as chiropractors, the subluxation. So how do subluxations occur is just from your daily wear and tear, from sitting with your legs crossed, carrying your purse, doing the laundry, sleeping incorrectly, maybe the yard work. All those daily stresses start to cause those joints to become misaligned or stop moving correctly.
So how would that work? They would move from...
So basically they just get stuck in a certain motion. As they get stuck in that certain motion, that's when you start to get that pulling or tension on those nerves. And when you get the pulling or tension on those nerves, then you're going to start to have those symptoms. You know, whether your symptoms is pain, muscle spasms, or lack of mobility is one area that we look at. Also on the deeper level, like we talked about with the nervous system, when you have pressures placed on those nerves, it can affect whatever organ or tissue that nerve is going to. For example, in this area here, a lot of times people will experience, you know, maybe constipation because those nerves go to that large colon.
Wow. Well, you mentioned the garden. I think I got that one the other day when I was planting my garden. Okay, that's amazing. So we can put this back if you want.
Yeah.
The spine is heavy. So then what, as you tried to explain then, what is the chiropractor's job?
Well, the chiropractor's job is to make sure that overall we keep you healthy and moving. And how we do that is with that spinal adjustment. So when we go through our evaluation, we're looking for those areas in your spine that are not moving correctly or that are misaligned. And then we put motion back into those joints with that chiropractic adjustment. When we restore that normal movement or alignment within the spine, then it takes that pressure off those nerves so your body can start to function at 100% again. So whether that means decrease in pain, increase in mobility, or decrease in overall sickness, that's the goal.
That's great. Well, there are those who are reluctant and sometimes say that a chiropractor is not a doctor. How do you respond to that?
Well, there are a lot of different kind of doctors that we go to, and chiropractors are your specialists for your spine, you know, to make sure that your spine stays well. We definitely do, you know, help people with pain, but overall, our goal is, as spinal doctors, is to make sure we're encouraging movement in your spine so that you can continue to move well. Like you talked about, as we age and we get older, if we aren't doing anything to continue to keep our movement in our spine, it's going to go away. So we have to be preventative in that aspect. So overall, how I would address that is that, you know, if you're looking for a specialist to stay well and to make sure that you're moving pain-free, then that's when you see that chiropractor.
Okay. And some people, it's not just reluctant, but some are fearful of chiropractic, like, oh, ouch, you know, that it's going to hurt. So, and this could pertain particularly to seniors, the fear factor. How should older patients be treated differently? Are they?
Well, that, you know, a lot of questions in that question. So first of all, I understand that people become fearful of going to the chiropractor, but first of all, I'd want you to understand that, you know, chiropractic is all natural, drug-free, and very effective. And the standpoint that with chiropractic, not only is it safe, and probably one of the biggest stats that I always say that really shows how chiropractic is safe is the amount that we pay for our malpractice insurance. I'm sure I pay less for my malpractice insurance than you probably do for your owner insurance. So that shows, you know, our safety for chiropractic. Two, you know, as far as how is it going to differ for maybe a senior or someone older, is that we have a lot of different techniques that we utilize, and we pair that technique to the patient to make sure that chiropractic continues to be safe and effective as we continue to age. So how I adjust a 20-year-old isn't going to be how I adjust a 70-year-old or 80-year-old. So each patient is going to have a technique that's tailored to them to make sure that not only is it safe, but it's effective as well.
And you have what I call the clicker.
Yes.
Can be better to use in some cases than actual movement.
Correct. So there, like I said, with a lot of those different techniques, the clicker or the activator, which a lot of patients really enjoy and get great results with, basically we can really control the amount of pressure that's put into the spine. So if someone does have osteoporosis or osteopenia, or just are afraid of chiropractic care and you just don't know what to expect, that's a great technique for us to start with. That's really low force, but definitely continues to get those results with chiropractic care.
That is true. That is great. So the senior factor is doable.
Yes, absolutely.
Well, I believe that we are realizing that each vertebra or each nerve inside the vertebra leads to something. Like
Correct.
these all lead to something. And we want to talk more about that. We want to point out where some of these do lead to. And we're looking at a very important diagram now. And it's not only important, it's beautiful in color. So let's talk about that. This is all so amazing. And look at the diagram is amazing. And it's to think I have all of that in here.
Yes.
Golly, it's just, it's like a miracle. So, say if there's a problem at, what, the T2 or T3 subluxation, Dr. Smith, how might that impact other areas?
Well, those nerves in that T2, T3 area
And
are
where's
going,
that?
that's going to be right here. Those nerves are going to be going to, the heart, the lungs, some very important organs that we want to make sure are functioning at 100%, as we continue to age. And as you look at that chart, the biggest thing to realize is that when we're giving that chiropractic adjustment, we are allowing your body to function at 100%, and so just allowing that decrease in pulling or tension on the nerves allows the messages from the brain to the rest of the body to flow at a higher level so your body stays healthier.
Well, could you point out a few of the others? I have this nerve chart here.
Yes, absolutely. As you can look at that nerve chart, probably another main area that we focus on a lot is that lower thoracic and upper lumbar area, which we kind of talked about briefly before, which is a lot of your digestive issues. A lot of patients that get adjusted start to notice that their whole digestive system is working better. Another common thing that we hear back in the office all the time is this area right through here, that like T6 area, T5 area, and that area goes to the stomach. And a lot of patients that get adjusted that experience heartburn notice that those symptoms start to decrease when their spine is correctly aligned.
Oh, and there's an actual movement for that area, which I receive.
That is correct. We can do an adjustment on that actual soft tissue area to loosen that up too, to make sure that you don't have those symptoms of the acid reflux.
That's great. So, like we said, everything is related, like T11, kidney, small intestines, and down to the lumbar, in appendix, abdomen, uterus, bladder, knees, upper leg, lower leg, ankles, feet. Oh my Lord.
Yes, as you can see with that chart, nothing can work without the nerves that come out from the spine.
It's so amazing. It's just amazing. Well, and I'm actually a good example here because I had gone to the chiropractor and for some time, but no one had really explained to me the important connection of all of these nerves and, the vertebrae. So I had an annual exam with x-rays, and all was well except for a minor problem. And we sat down with the doctor who reviewed the x-ray, and she pointed to a problem. She said, 7C, thoracic, which is where?
The seventh cervical vertebra is right here.
Right there.
Yes.
She said, that's thyroid. I went, bingo, because that was my problem. So it was clearly defined and explained to me, what is actually going on. And I've worked with it different ways since, and fortunately it's better now.
Good.
But, so this is all a very complex subject in a way.
It is. Chiropractic is very simple of what we do, but has a huge impact, not on your pain, but as you can see, we were looking at that chart, the body as a whole, or that whole nervous system.
And in ways it's really difficult to explain that to people, to convince them. Like, do you know that every one of these is related to an organ in the body? Hello. So, could you briefly address chronic inflammation?
Yes, so a lot of individuals come to us and they've just become chronically inflamed. And so the way chiropractic helps with that is starting to reintroduce that motion into the body to start to flush out some of that inflammation. But a lot of our inflammation is really due to our habits, maybe what we're eating that's causing inflammation within our body.
And so what exactly is inflammation? Is it a swelling or?
So when you get some chronic inflammation in your spine, it's usually due to the fact that your body has been misaligned for a long period of time or not moving correctly for a long period of time. So that inflammation just kind of gets stuck there. Like your body just stops, doesn't heal it anymore because it's been in that incorrect position for so long.
So that's kind of what inflammation is in general.
Well, inflammation in general is just going to be a localized swelling.
Okay.
So the joint, maybe swelling within the joint, and so that the tissues aren't as healthy.
So if it's in the back and then comes the back pain.
Yes.
I have that at certain times. Okay, well, let's talk about back surgery. What are the drawbacks or the risks of back surgery?
Well, back surgery is a touchy subject, right? Because,
Yes.
it's a big investment to go under the knife to have surgery. And
Right.
so sometimes, absolutely, it's necessary and there's no way around it. But, WebMD just published a study of 1.7 million patients, and they found that with that group of patients, that chiropractic reduced surgeries by 42%.
Oh my goodness.
And so that is huge. And so that's where, people need to choose conservative care first, and chiropractic can play a big role in your conservative care.
And when we were talking before, I think you mentioned that as far as surgery, or you actually work sometimes with other physicians, for example, pain management.
Yes. As we age, pain becomes a very complicated situation. And so a lot of times you need a good team to work with. And so in our office, we're not going to, or in chiropractic in general, we're not going to look at chiropractic being the only tool to use. A lot of times we have to combine those tools, whether it's, bringing in a physical therapist, bringing in some pain management, so that, the end goal is that the patient's getting that quality care to, get better. But when we look at things together, if we're using someone to help with pain, if you're using something for pain management, maybe injections or medications, that's great. That's going to cover up that pain so you don't feel it. But that's also the best time to see a chiropractor, because we're able to start to change the way your body moves without that increase in pain. So not only do you not have that pain, but we're fixing on the root cause of that problem. And so doing both at once sometimes is a really big advantage to that patient.
And that brings us to the point of injections.
Yes.
What is it, cortisone?
Yes.
Could you talk about that?
So, I don't think it should be the first resort, but sometimes, it is necessary to help decrease, that chronic inflammation that we're talking about. Sometimes when the problem's been there so long, your body needs a little extra help. But, with chiropractic, we want to work before that you get to the point of having a cortisone shot. And so that's where a lot of people, are coming in even when they're not in pain, to make sure they don't get to that point of chronic pain of having to take those cortisone
Well, and that's
shots.
myself. I've done chiropractic for maintenance for at least 10 years.
Yes.
And there is some harm about over repeated cortisone shots, I believe.
Yes, there is. The research definitely shows that, frequent cortisone shots overall are going to weaken the tissue surrounding the joint. And so, we don't want to rely on them. That's why I said sometimes if we combine efforts, it's great, but you don't want to just rely on just the pain medication and not changing the way your body's moving.
So it can be an alternative to surgery.
Yes.
We want to make that point clear. I have here a list of 10 ways from your website.
Yeah.
10 ways that chiropractic care can help. So let's talk about some of these. And as you said, they all have the same answer in a way, adjustments. But about back pain, as far as what can be done that.
So with the back pain, typically it's due to lack of motion, mostly within what a lot of people would say their hips or their pelvis. So
low back pain,
yeah.
everyone complains about.
Yes, and so we make sure that that pelvis is moving correctly so that you can walk, because these joints have to move back and forth when you're walking. So if they're not moving back and forth like they should, then they start to put pressure up into that lumbar spine, which creates more tension on those nerves that are coming out. So with that lower back pain, we're going to analyze how that, not only that lower back's moving, but also that pelvis, to restore that normal motion in through the spine, so it takes the pressure off of those nerves. But also, most chiropractors are going to address the muscles surrounding the area too. Does the patient need certain stretches or exercises to strengthen and help support that adjustment?
Now, you're not a surgeon, but when a hip replacement, is this entire area replaced?
No, so the hip is here. A lot of people refer to this as their hip, but that would actually be the pelvis or the SI joint, the left. So, but the hip is actually all the way down here.
Oh, wow. And it's like a
Yep.
ball.
It's like a ball and socket joint, just like your shoulder.
Okay, and that's what is replaced.
That is the portion that is replaced, right?
That's very common now.
Very common.
And a lady at where I work, just had hers done, and she's recovering remarkably.
Yes.
So it's amazing.
It is amazing. We're glad surgery is available because sometimes you need it.
But is this actually the kind
Yep.
of
So that's that bone that if you put your hands on your hips, right? That you would
Yeah.
put your
Oh,
hands on.
okay.
So yeah,
And that's all part of the pelvic
correct.
bone system. Wow, that's interesting. So a lot of people have headaches or migraines.
Yeah. So that is the top 5 thing that we treat in our office.
Really?
Headaches and migraines.
Wow.
When we decrease that tension in the neck, that decreases the tension that's creating those headaches. Also, when we're doing the adjustments, it can alter the posture of a patient, which again decreases that tension, at that base of your head or neck, which is also going to help decrease the headaches.
And remember, the neck has to hold up quite a bit of weight. How much does the head weigh?
That's
5
right.
pounds?
No, much more than that. Your head, depending on your height and weight, your head definitely varies in weight. So your head probably weighs about 10 to 12 pounds,
Oh,
and you're
wow.
petite.
And how much hair you have? No,
Yeah.
hair doesn't weigh a lot.
And so that's a big factor with the neck pain.
Yeah,
Also,
isn't it true?
We're talking about that posture, especially now when people are looking down all the time. I mean, no matter your age, most people have their phones.
Or the computer.
Or the computer, or even reading, and being aware of bringing that book up so you're not looking down to put that stress into your neck.
And speaking of the neck, what about whiplash? I have that.
Yes. And so
I had that, but still have it.
Exactly. So a lot of those injuries, your body never completely goes back to normal with, for example, whiplash, because those ligaments are affected and the joint motion is affected.
For example, an auto accident, rear-ended, that's usually whiplash, and that happened to me years ago, but I still have, it removes some of the curvature in the neck.
Yeah, and that's why you do chiropractic now, because you had that injury, and so you know that if you get those regular adjustments, it keeps your spine healthier because you did have that previous injury, and that's where chiropractic is great, at making sure we keep that motion in there.
Well, and there are others listed here. I'd like to talk about sciatica. That seems to be so prevalent today, and I wonder why.
Well, I think a lot of people say sciatica for a lot of different pains they have, but the sciatic pain, basically this is the sciatic nerve, and I'm going to turn this over here, and so you can see all of these nerves coming out,
Right.
and they come together to form that sciatic nerve.
Oh, wow.
So you have a lot of opportunity to put pressure on those nerves
I
to get
see.
that sciatic pain. So whether it's up here, down here, and through here, all of those different areas can cause that pressure into that sciatica. So when you have that sciatic pain, basically that's going to be the pain down into either your buttocks, back of your leg, and possibly down into that calf
Shooting
as well.
down.
That pain shooting down your leg.
So proper adjustments.
Correct. Proper adjustments, and also giving patients tips too on how you should sleep, how you should sit, to make sure that when you're sitting, you're not crossing your legs or you're not sitting on your leg. When you sleep, to make sure you put a pillow between your legs, to make sure you're keeping that pelvis or level so that you're not putting constant tension. in
Now,
that sciatic nerve.
I was told that back sleeping is preferred.
Yeah, so back or side, either
Back
one
or
is
side?
fine.
Oh,
Yeah.
good. Good. I'm glad to hear that. Yes, because I have, friends and family with sciatica problems, and it's sad, really. Now, scoliosis, that's another issue that I have. I always joke and say my mother dropped me when I was a baby, but we don't know for sure. So that's an issue too, and can be.
Yeah, so, when we get older in that curve, like for example, you have that scoliosis in your body, and so you benefit even more with chiropractic because we're keeping as much mobility in each and every joint so that it doesn't put pressure on those points of your curve, which then make you more vulnerable to have those compression fractures. And that's what we want to avoid by keeping that overall movement through your spine.
And I really had no idea until I actually had a friend, this was years ago, who was a chiropractor, and he just did kind of an exam, and he goes, "Oh, you have curvature." I go, "What?"
Most people don't know.
Yeah. But if it's a young person, I guess it can be possibly corrected.
Correct. A lot of those scoliosis is if they're found when the individual's younger, they can make an impact in the curve.
All right, good to know. Well, gosh, it's other things here, arm and leg. You do carpal tunnel, or chiropractic does carpal tunnel, work injuries, disc injuries. There's so much, and we talked about neck pain and carpal tunnel. Is that from work typically, or?
Yeah, typically it's from repetitive injuries, and that's kind of the theme like we talked about, just that repetitive stress, everyday stress is where most people's injuries come from. And again, that's why wouldn't you do something preventative once a month to take that stress out of your body?
Well, and I know that I work in an office 3 days a week, and believe me, sitting, I used to do it full time, but 3 days is more than sufficient. Because, sometimes you have to get up and walk sometimes, just get up.
Yes, and that's probably one of the hardest thing on people is sitting. So the best thing to do is to make sure you take those breaks.
Yeah.
And, whether it's 10 minutes before you sit down, 10 minutes at lunch, and 10 minutes, at the end of the day to restore that movement.
And we talked about earlier, too, about chiropractic is not your quick fix. You need to continue the treatment, as I have for over 10 years, like once a month even.
Absolutely. So initially when people start care, we'll do frequent treatment because it's that frequency that allows us to change the way the body's moving. Once we get that body to a stabilized position, then we recommend wellness or maintenance, because once you've done all that work to get your body moving, we want to keep it there because you're going to continue to do all the things that cause that stress in your body.
Well, this has been such a great program and so informative. Thank you, Dr. Smith, for being here. Really appreciate it. And thank you for watching Senior Living. Please join us again next time for another important topic of interest. So until we meet again, this is Lynn Brennan saying goodbye now for now. Happy, healthy aging, and God bless.